The English Nurse by Professor Charles Lane Olmsted. Chapter 6, Patient Care, a Gimcheon University presentation. Vocabulary: patient, patient. Hereditary, hereditary. Triglycerides, triglycerides. Infection, infection. Abrasion, abrasion. Anemia, anemia. Malignant, malignant. Benign, benign. Colonoscopy, colonoscopy. Oxygen level, oxygen level. Hypertension, hypertension. Dialysis, dialysis. Abscess, abscess. Cramps, cramps. Chronic, chronic. Acute, acute. Polyps, polyps. Edema, edema. Contusion, contusion. Allergy, allergy. CT scan, CT scan. Cellulitis, cellulitis. Myalgia, myalgia. Cholesterol, cholesterol. Prefixes, suffixes, abbreviations. CYTO, cell, cytophoresis. Procedure where cells can be separated from blood and stored. Encephalo, related to the brain. Encephalitis, inflammation of the brain. Neuro, pertaining to nerves and nervous system. Neurologist, doctor who deals with nervous system and brain disorders. Pulmono, related to the lungs. Pulmonary edema, fluid accumulates in lungs. Somat, S-O-M-A-T, pertaining to the body. Somatype, structure of build of a person's body. HDLC, high-density lipoproteins cholesterol. That's the good cholesterol. LDL-C, low-density lipoproteins cholesterol. That's the bad cholesterol. EEG, electroencephalogram, monitors brain waves. Sentence patterns. Do you have a family history of high cholesterol? Do you have a family history of high blood pressure? Do you have a family history of hypertension? How long have you had cramps? How long have you had constipation? How long have you had this abrasion? 3. I am worried about his oxygen level. I am worried about this abscess. I am worried about his polyps. He may need to go on dialysis. He may need to get a weekly transfusion. 5. Her cholesterol is high, so we need to put her on medication. Her triglycerides are high, so we need to put her on medication. Her blood pressure is high, so we need to put her on medication. Sentences. The doctor said my foot has edema, which is just fluid buildup under the skin. He received an abrasion on his face from fainting. Heart problems are hereditary in my family. Doctors make horrible patients when they get sick. Your son has anemia, so cook him a steak for dinner. If you don't clean and bandage that cut, infection will set in. My friend goes to dialysis twice a week while he waits for a kidney transplant. The doctor removed 2 polyps during my last colonoscopy. I take medicine for my high blood pressure. I got cramps because I went swimming too soon after a big lunch. The toothache turned into an abscess, so now I have to get the tooth removed. I have high cholesterol that I control with medication. The only allergy I have is to tetracycline. It makes me nauseous. The serious cases of coronavirus cut people's oxygen level drastically. It's been a chronic pain in my stomach for over a week. Walking an hour each day has lowered my hypertension. A high triglyceride level leaves you at greater risk for a stroke. A CT scan discovered the patient has a small kidney stone. He received a contusion on his arm from a baseball. When I have myalgia, it is either from stress or a strain. He ate extra spicy tteokbokki and developed acute indigestion. Don't worry, we removed the growth and it's benign. The lung biopsy showed it as malignant, but we think we caught it in time. Conversation A, between patient and nurse Yu Jung. Nurse, can I get out of bed? I need to go to the bathroom. Let me check your blood pressure. No, sorry, it needs to be below 120/80. Why? What is it? It's 138/88. It needs to be lower so you don't bleed from your incision. They ran the tube up from your femoral artery to put the stent in. Okay, but I still need to go to the bathroom. Here's a bedpan. How long before it goes down? You just need to relax and don't think about it. Oh, and they took your underwear off in surgery. Yeah, that was my next question. Okay, thank you. Questions. Why is the patient not allowed to get out of bed? What kind of surgery did he have? 3. What do they fear could happen if he stands up with high blood pressure? Did you know? These are some of the typical departments in most hospitals. Some hospitals are specialty hospitals, such as for women, cardiac care, burn patients, children, and cancer patients. NICU, Neonatal Intensive Care Unit. ICU, Intensive Care Unit. CCU, Cardiac Care Unit. ER, Emergency Room. OR, Operating Room. Oncology, Pediatrics, X-ray, Delivery Room, Psych, or Psychiatry, and Pharmacy. Reading, Medical Tourism Destination. South Korea is fast becoming the medical tourist capital of the world. It is already a top destination for patients in search of the top gastric cancer treatment, as well as cosmetic surgery. Now it is becoming a popular destination for physicians wanting to learn more about different state-of-the-art techniques. A 2018 Korea Times article entitled "Chinese Doctors Favor Korea for Cancer Treatment Training" reported that Seoul National University Hospital surpassed 30,000 gastric cancer surgeries that year, most in the world. It performs about 1,000 gastric cancer operations a year, also tops in the world. Patients like the postoperative mortality rate of 0.6%, the lowest worldwide. European hospitals are at 10%. The hospital system is working from all angles to improve results in care. Gastric Cancer Center Director Dr. Yang Han Kwang is involved in important clinical trials. The regatta is designed to address whether removal of the primary cancer is beneficial to patients with distant metastases. It is the first trial to suggest the removal prior to chemotherapy as frontline treatment for advanced gastric cancer. 2 state-of-the-art equipment, CyberKnife and Gamma Knife, are used to selectively track and remove cancer tissue without invasive surgical operations. Korea also uses the famous Da Benchi surgery, which is a minimally invasive robotic surgical procedure. It is one that foreign surgeons come to observe and train. The Korea Health Industry Development Institute provides high-quality medical services. They use state-of-the-art equipment in which protons are used to selectively attack cancer cells to minimize normal tissue damage and harmful side effects. Some hospitals run robotic surgery training centers for foreign doctors so they can observe and learn new techniques. Korea Accreditation Program for hospitals serving foreign patients has 130 standards established and overseen by the Korean Ministry of Health and Welfare. 31 hospitals nationwide applied for special designation in 2017, but only 5 passed. The standards range from speaking languages for the patient's benefit to infection control measures to emergency response measures. China and Korea began cancer management workshops in 2013, with Japan joining the group in 2018. South Korea had the highest percentage of elective surgeries in the world in 2011, with about 650,000 procedures. That is about 1 for every 5 women, much more than the 1 in 20 for American women. The top 3 cosmetic surgeries in Korea are liposuction, nose jobs, and double eyelid surgery. The eyelid surgery makes the eyes appear larger by reshaping the skin under the eye. 15% of all cosmetic surgery in the world is the double eyelid surgery. In another year, the second most popular surgery in Korea was the jaw reduction surgery, where the bone is shaved to create a V-line. Another popular eye job, sometimes done at the same time as the double eyelid, is the corners of the eyes are cut to make it longer horizontally. Conversation B. This is between Nurse Hana and Si Young. Congratulations, I hear you are going home today. Are you ready? Absolutely. My clothes are in the bag, my ride is on the way. I have your discharge papers here, so I need to go over that with you. Okay, I'm listening. First, no driving for 2 weeks. No strenuous activity for 2 weeks. No lifting anything over 4 kilograms for the first week. Anything I can do? You can have an easy 5-minute walk every 2 hours, then rest. You had hernia surgery, so you don't want to put that under pressure and strain yourself. I understand. My right is out front. Any restrictions on food? No alcohol and no caffeine the first week. Drink about 2 quarts of water and juice a day for the first 3 days. Any questions? Well, my girlfriend is picking me up. Oh, give that a week too and go slow. Sign this showing you understand. If you pull anything or notice blood in your urine, go to the doctor's office or emergency room. Gotcha. Thank you. Bye. I'll take you down in a wheelchair. Hospital policy. Questions. What kind of surgery did the patient have? What drinks are not allowed the first week? What should he do if he notices blood in the urine? What might blood in the urine mean? Why is it important that he not lift anything heavy? Why can't he drive? Why should he walk a little?